Hi, this is Dr. Director Hassan, practicing reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today with Dr. Sadaf Sagir, a pediatric gastroenterologist in the Dallas-Fort Worth area. Dr. Sagir, welcome to the show.
Hello, everyone. Thank you, Dorette, for having me on the show.
Absolutely welcome. Please tell us a little bit about yourself and your practice.
Sure. So I'm a pediatric gastroenterologist. I take care of the kids anywhere from prematurity, newborn, all the way to 18 years of age. I take care of anything related to their GI tract, which means anything that starts from the mouth all the way to the end, with including feeding intolerance, their stomach problem, any problem with their guts, small intestine, large intestine, diarrhea, constipation, vomiting, problem in gaining weight, to obesity, too much gaining weight, their liver issues, food allergies, celiac, you name it, anything related to GI, we take care of that. I am with the Digestive Health Associates of Texas, and pretty much this group serves the DFW area. During this, I have our main clinic in Arlington, and then I do satellites in North Richland area and Mansfield. However, during COVID, we are currently working mainly from the Arlington. Having said that, I do televisits, so this way we are able to cover very far off places, even like few hours away from here, we are able to do televisits, and they don't have to come to the clinic, but also I have expanded our locations regarding procedures. So I'm affiliated with Medical City Arlington, Children's Hospital Plano, and Medical City Dallas. So this way, if whatever the facility is closer to them, we can take care of the procedures over there. Our office number is 214-630-4320, and our fax number is 469-713-8064. Being a pediatric gastroenterologist, actually, with our practice, I'm making sure that whatever referral we are getting, we take care of it within 24 to 48 hours. So patients really don't have to wait a long time. And taking almost all the insurances, including almost all the commercial insurances, TRICARE, Medicaid, Amerigroup, or traditional self-pay. The whole idea is providing patient care around the DFW.
Oh, fantastic. And it sounds like you cover many disorders in the newborn and the pediatric population, all the way up until they are adults. One of the ones that you mentioned really caught my attention was liver disease. As many of my patients, they take home their babies, they are excited, they have newborns, but one of the common things that can be seen in the newborn is hyperbilirubinemia. Can you tell us a little bit about that?
Sure. This is a very important topic, especially in the newborn phase. So first of all, congratulations to all the newborn moms, okay? And simple things, I'm gonna first start with the basic knowledge. What is bilirubin? So bilirubin in our body is a byproduct where the hemoglobin, our blood, is broken down. So the byproduct of it is taken to our liver, okay? Now, liver works as a washing machine for our body to get rid of all the toxic materials. And this is where there are two types of bilirubin. There is a indirect and there is direct. One, which is prior to getting processed in the liver, and the other one, which is direct, means related to the liver processing, okay? Now in newborn, because when they are newborn, their blood is on the higher side. Their hemoglobin is a little bit on the higher side. Once they are born, there's something what we call it physiologic jaundice. Physiologic jaundice happens when this bilirubin level is higher than normal in your body. Now what happens when you are born, the way your red blood cells break down over a period of first week or 10 days, it's much faster. So what happens while your liver is still catching up on processing all that bilirubin is built up in your body, and you start seeing the yellowish discoloration in your child. If it's a dark color skin child, then what can happen is easily prominent when you have a light skin tone. You may not be able to see it very easily in a dark skin tone. So what happens, you may be able to see in the white part of your eye some yellow tinge, yellow color. So those are the things you have to keep in mind and take them to the doctor. Now, this is known as physiologic jaundice, which means by the time, like by first 2 weeks or by 10th day, it usually gets better and it's resolved, because now your body, the baby body, has started working in a proper way and able to take care of the load of red blood cells breakdown. This is known as physiologic jaundice. What we do over there, we make sure that the baby in the first 10 days of life is hydrated very well. Now in the first 10 days of life, what happened, baby loses weight, but by the time it is 10th day or 14th day, they regain 10% of that lost body weight, okay? So making sure baby is well hydrated, because the more you poop, the more you pass bowel movement, easy to get rid of that, all that bilirubin not sitting there. Because while the poop is sitting in your guts, what happens, this bilirubin pigment, which is also supposed to come out with the poop, it stays there. So body starts re-regulating it. So the good thing is making sure they're hydrated well, they're getting the feeds well. It's not too much of yellowness. So sometimes your doctor may have them repeated the bilirubin level, because if they don't take care of this or the bilirubin has not started trending down, it can start affecting their brains also. And that is the reason why it is very important. If your child is having a yellow discoloration, it needs to be monitored until it slowly starts trending down. Now, this is called physiologic jaundice. Sometimes what we say is doctors will tell you to have the baby sit under the ultraviolet rays early in the morning in the sunlight. When that happens, you don't have to put the baby out in the sun. Make sure it's indoor, okay? You can have them in their diaper while it is not too cold and it is not too hot. Early in the morning, because ultraviolet rays helps through the skin breaking down of the bilirubin and easy to getting rid of it through the bowels. So it is the whole molecular or the chemical, the way it works. This is where the whole thought process is, how this thing works. Now, this is physiologic jaundice. The most important thing when it comes to newborn, if you start seeing that, okay, my baby, their bilirubin was getting better, their jaundice getting better, now it has slightly started going into 3rd week, 4th week, this is where it becomes concerning. Physiologic means something benign. Then it starts concerning, because now we have to think about there's some issue going on with the liver, and it is very time sensitive. There is a disease or the problem with the liver, we call it biliary atresia. Biliary means the bile ducts through which the bile or the bilirubin part of the bile, it flows through those ducts. Slowly what starts happening, they start getting destructed, and your liver starts getting affected with that. This is time sensitive, because by 6 weeks, it should be diagnosed by 6 weeks and get a surgical correction. There are some surgical process how you can do it also, but the initial test is as simple as getting the liver ultrasound. If you have a baby by 3rd to 4th week whose liver bilirubin is not getting better, then you get it checked. And this is time, instead of indirect, remember which I mentioned that the bilirubin which has not been processed yet from the liver, in this one, the direct bilirubin will slowly started going up. And that would be the indication now there is not a problem with the red blood cell, there's a problem with the liver. We do the ultrasound. Sometimes if the ultrasound shows concerns for biliary atresia, then it is a surgical case. If there has been a research which shows that if these biliary atresia has been corrected by 6 weeks of life, so 4th to 6th week is very important, 14 days period. If it has been corrected, the procedure is known as Kasai procedure. The outcome is very much favorable for the baby. Otherwise, it's really, it gets very a poor outcome. The numbers pretty much go down and these babies can get very sick. They may end up requiring a liver transplant. If liver transplant is not done in a timely manner, they may not even make it later in life.
Oh, well, thank you so much for telling us about that process. You mentioned the skin discoloration, the yellow discoloration on the skin. Other things that the newborn mom can sometimes feel uncomfortable with is rash, and we don't know what types of rash, which rashes we should be concerned about, which rashes are normal. Can you tell us a little bit about rashes in the newborn?
Sure, Dorit, I will tell you. I just recall that I do have to mention one more part about the biliary atresia. If you see your child is having, your newborn baby is having a white color stools, that's another thing they have to keep in mind also. Okay. All right, now back to rashes. Okay, newborn babies, very benign rash. We call a baby acne. They may have heard a lot from their pediatricians, from the newborn nursery doctors also, or the nurses. Baby acne is a benign rash. Usually you see a small white spots or the red spots around their cheeks and on the tip of their nose. It is not, you will see your baby is not being bothered. They are not scratching their face. They become a little bit reddish, especially when baby is fussing around. Otherwise, it's a benign phase. The reason behind this rash is because they are just newborn. They still have the maternal hormones circulating in them, like estrogen, progesterones, which gives rise to these rashes, just like acne when we have it during a teenage year. But that it's usually you would see it in the first month or 2 months of life, but then they eventually self-resolve. Nothing big you have to do, just make sure as much skin is not very dry, moisturized. You can keep it clean with water and a baby soap if you have to, but no any, you don't really need like hydrocortisone or these, because these rashes are benign and they self-resolve. This is called baby acne. One important thing from the GI point of view, one rash that I always look for, and I have had several cases for that also, eczema. That's what we call. Eczema is a type of rash, very reddish color rash. You can see mostly like in the neck, skin folds. You have in the arm where the flexor over this area or around their diaper area, wherever there's a skin fold or on their back. It's not 100% always on the skin fold or the extensor side. It can be anywhere. It's the type of rash that develops. This rash doesn't eventually go away. And this can also be in relation to cow milk protein allergy, because in a newborn phase, baby has not been exposed to anything else except for the milk, right? Whether it's a mom's milk or it's a standard formula milk. If there is an ongoing process, cow milk protein allergy, you can see that. There may be some contributing factors also from the environmental allergens, but I have had cases where once I have put them on a complete broken down amino acid formula, these baby have started, their rash have started getting significantly better. Obviously, sometimes you may have to make sure that they are moisturized well, especially during winter season, and they may require hydrocortisone or steroid creams topically to help them. But it is all about if the proteins or their body is not tolerating, their flare will keep on going on. So that's another thing where not everybody thinks like why rash would be related to GI, but yes, your body does respond to type of foods or the proteins it's being exposed to.
Wonderful. Thank you for that incredibly good explanation. And now we know what to look for in terms of rashes. Are there anything else you would like to leave with our audience before we close the show?
There are many newborn feeding issues could be going on. Yellow jaundice, rashes can be anything that seems not sitting well with your child. As a pediatrician, as a GI, I can tell, I want moms to be sure to seek medical advice. And in newborn period, first 4 to 8 weeks of life are very crucial in terms of making sure how they are exposed to outside world, getting infection. Babies seem to be too sleepy. Babies seem to be not tolerating feeds or just fussing, and you are really not seeing any vomiting, but you find that your baby is gradually getting fussing. Those are the things need to be addressed by the doctor. So don't delay in seeking the medical advice. Besides that, I'm always available. You can make a phone call to our office, and we try our best to get the patient taken care within 24 to 48 hours, whether it's a televisit or it's a clinic visit. And our office number is 214-630-4320. I am with Digestive Health Associates of Texas and here to help you out.
Thank you, Dr. Sagir. Have a good day. Bye, everyone.
Bye.